What's all of this paper? These instructions aren't clear.
I feel embarrassed to ask questions when I don't understand.
Well, I'm trying to learn English, but these directions are very difficult to understand.
Studies show that many Americans with the greatest healthcare needs have the least ability to comprehend information required to navigate and function in the U.S. healthcare system.
Hey Michelle, how was your day?
It was okay.
Mine was a little difficult. Our one patient came back today. She had been in the hospital and they discharged her. And it was clear she wasn't taking her medications, nothing was resolving, and I tried to figure out what was wrong, and eventually she told me that when she was discharged from the hospital, one of the nurses came in and explained all her medications to her, and for some reason they were numbered at the top, and maybe that was to explain to her that there were 6 different medications and she needed to get them filled. But her impression was that she needed to take the medications in sequence. So start with the first one and then finish that one and then move on to the second one, instead of getting them all filled at the same time and taking them as she was prescribed by the physician at the hospital. So it's just nothing's resolving.
The Institute of Medicine defines health literacy as the ability to obtain, process, and understand basic health information. Low or limited health literacy is prevalent, affecting over 4 million people in the state of Pennsylvania alone. Included in the 4 million are the elderly, persons with limited education, members of ethnic minorities, and people who spoke a language other than English in their childhood homes. Unemployed persons, those with limited income, and individuals insured by Medicaid are also more likely to have limited health literacy.
So since this is such a big problem, what's your plan to change it?
Well, we set up another appointment tomorrow, and I'm going to have her bring in all her medications, anything related to her hospitalization. We're going to lay it all out. I'm going to organize it and make sure it's reconciled, and then we're going to have to do teach back. I'm just going to have to explain all her medications and when she needs to take them, and we're going to keep doing that until she can teach back to me what I've told her and she's correct. So hopefully we can accomplish that in one visit, but if need be, I'll probably have to call her or have her come back another couple times just to make sure everything's going okay.
Limited or low health literacy is associated with worse health outcomes and higher costs. The adverse outcomes associated with low health literacy include overall poorer health status, higher rates of hospitalization, less awareness of preventative health measures, less knowledge of medical conditions and self-care abilities, more medication errors, less routine health care, and increased mortality.
So do you know what this patient's health literacy level is, or where he's from, kind of his background with things? Because I know that there's a literacy center at the hospital that he could go to get more education.
That might be really helpful because the family immigrated here and their English is not that good, and I don't think anyone in the family really understands English very well, and they probably also didn't really receive much education where they came from, so that could be part of the plan that we're updating.
It is estimated that the cost of low health literacy is in the billions for the state of Pennsylvania. The path to achieving a more literate and health-literate America is complex and requires multiple strategies within healthcare, education, and public health systems. One goal is to promote changes in the healthcare system that improve health information, communication, informed decision-making, and access to health services. Another goal is to support and expand local community efforts to provide adult education to include English literacy and culturally appropriate health information services.
I'm so frustrated. I just called the literacy center and there's a huge huge waiting list. I can't get my patient in there.
You know, after we got done talking about this, I did some research on the topic because I just feel like our area can't be the only area that's having this problem. And I found that budget cuts have cut back the funding for the literacy center, and when they did have enough funds, only 3% of the people could get in to receive the education that they needed. So this is a huge problem that we need to address and start at.
That's really unfortunate. This doesn't just have an immediate impact on the safety of my patients, but if they're unable to get resources to be able to learn how to manage their diseases better, especially diabetes or any of the chronic diseases, the risk of complications is so great. It's just so costly, both to society, and it's so burdensome on the patients.
Few hospital systems or communities are addressing health literacy. It's time for change. Healthcare systems, patients, providers, and community-based organizations must work together to identify community issues, share resources, and create collaborative solutions. To create local action plans that address health literacy where each stakeholder plays a role, and to present a clear case to lawmakers, philanthropists, and decision-makers that will lead to adequate funding for action plans. Low health literacy is a silent but major indicator of poor health outcomes. We can't be silent.